Have you ever felt a strange pain in your stomach, brushed it off as gas, and moved on with your day? What if that small signal was actually your body trying to warn you about something far more serious? Pancreatic cancer is one of the most silent and dangerous diseases because the early symptoms are often so subtle that most people ignore them. Many people only discover it when it has already progressed. But here's the good news. Your body usually sends warning signs first. The key is knowing what those signals look like. And today, I'm going to walk you through 8 early symptoms of pancreatic cancer that doctors say you should never ignore. But before we begin, if you care about protecting your health and staying strong as you age, make sure you subscribe to the channel and turn on the notification bell. Every week we share simple, science-based health tips designed especially for adults over 50. Now, let's start with the first warning sign. Imagine waking up one morning and noticing that the whites of your eyes look slightly yellow. Maybe your skin looks a little yellow too. At first, it might seem harmless, but this is actually one of the most common early signs doctors see in pancreatic cancer. This condition is called jaundice. The pancreas sits very close to the bile duct, which carries digestive fluids from the liver. When a tumor grows in the pancreas, it can block this duct. When that happens, bile builds up in the body, causing yellowing of the skin and eyes. Some people also notice dark urine, pale stools, or itchy skin along with this change. If you ever notice yellowing of your eyes or skin, it's important to see a doctor right away. Now here's something surprising. The next symptom often appears months before diagnosis, but most people completely overlook it. Sudden and unexplained weight loss. You haven't changed your diet, you're not exercising more, but the number on the scale keeps dropping. While many people might celebrate losing weight, unexplained weight loss can sometimes signal a serious underlying issue. Pancreatic tumors can interfere with digestion, making it harder for your body to absorb nutrients. As a result, the body slowly begins losing weight and muscle. If you lose more than 10 pounds without trying, doctors say it's something worth investigating. Now here's where things get even more confusing. Many pancreatic cancer patients actually experience persistent stomach pain long before diagnosis. This pain often begins in the upper abdomen and sometimes spreads to the back. People describe it as a dull ache that doesn't seem to go away. Because the pancreas is located deep in the abdomen, tumors can press on nearby nerves, creating this persistent discomfort. And here's something interesting. Many people notice the pain gets worse after eating or lying down. If you ever feel constant pain in your upper stomach or back that lasts for weeks, it's important not to ignore it. But the next symptom might surprise you even more. Changes in your stool. Yes, your bathroom habits can reveal a lot about your health. When the pancreas isn't working properly, it struggles to release enzymes that help digest fats. As a result, stool may become greasy, pale, or float in the toilet. Doctors call this steatorrhea. Many people mistake this for a simple digestive problem, but it can actually be a warning sign that the pancreas isn't functioning normally. Now let's talk about a symptom that many older adults experience but rarely connect to pancreatic health: loss of appetite. You may notice that food just doesn't seem appealing anymore. Meals that once excited you now feel like a chore. This can happen because tumors release substances that affect metabolism and hunger signals. Over time, this lack of appetite can contribute to fatigue and weight loss. Speaking of fatigue, extreme tiredness is another symptom that often appears early. This isn't the kind of tiredness that goes away with a nap. People describe it as a deep exhaustion that makes even simple tasks feel difficult. Cancer cells use a lot of the body's energy, and the immune system is constantly working to fight abnormal cells. This combination can leave the body feeling drained. Now here's a symptom that surprises many people: new-onset diabetes. Doctors have discovered that some people develop diabetes months or even years before pancreatic cancer is diagnosed. The pancreas produces insulin, the hormone that controls blood sugar. If a tumor disrupts this process, blood sugar levels can suddenly rise. For someone over 50 who develops diabetes without a clear reason, doctors sometimes investigate the pancreas more closely. And finally, there's one symptom that people rarely talk about: blood clots. Pancreatic cancer can increase the body's tendency to form clots in the veins. Sometimes the first sign is swelling, redness, or pain in the leg caused by a clot known as deep vein thrombosis. Other times, people experience sudden shortness of breath if a clot travels to the lungs. While blood clots can happen for many reasons, they can sometimes be linked to hidden cancers. Now, hearing these symptoms might feel a little frightening, but here's the important thing to remember. Most people who experience one or two of these symptoms do not have pancreatic cancer. However, what matters is persistence. Doctors always look for symptoms that last longer than expected, gradually worsen, or appear together. Your body has an incredible ability to signal when something isn't right. The key is simply paying attention. And that leads to an important question. Is there anything you can do to protect your pancreas and lower your risk? The answer is yes. Studies show that maintaining a healthy weight, avoiding smoking, controlling blood sugar, and staying physically active can all support pancreatic health. And one simple habit that cardiologists and longevity experts consistently recommend is daily walking. Regular walking improves circulation, reduces inflammation, supports metabolic health, and helps maintain a healthy weight, all factors that contribute to lowering cancer risk and protecting the heart. Even a simple 30-minute walk a day can make a meaningful difference. Your health is not determined by one big decision, but by small daily habits repeated over time. And the more informed you are, the more power you have to protect your future. If you found this video helpful, make sure to subscribe and share it with someone you care about. Awareness can truly save lives. And before you go, tell me in the comments, how many minutes do you usually walk each day? Your answer might inspire someone else to start taking care of their health today.